Hi everyone, Dr. Rob Kiltz. How you doing? See my fertility, fertile fireside chat. Time of year, temperatures dropping out there and the fire is coming on, kind of warming us all up. And it's always a pleasure to be sharing thoughts and ideas how to improve your fertility, either naturally or with assisted reproduction. Been away for a week, was here last Sunday in the same time, London. And had a really great time. T and I saw the sights and was really glad to get some time to rest and relax. And excited to be able to share some thoughts and ideas again, answer your questions. Always a pleasure. And please don't hesitate to throw those questions at me. We're going to share a lot of hellos to everyone. And I was watching Sarah Ofri's fertility support, and she was talking about CBD oil and about endometriosis and inflammation. And I talked a little bit about diet, and I was really glad to see the conversation going on. Again, it's always grateful to everyone to be sharing, liking. Your comments are really important to me and our entire CMI Fertility team. Lots of patience in the process because this is a hard journey. And I know it's like, oh, just hang back and relax, which I know I talk about it. It's not so simple. Monita, Andrea, Carolina, Sanja, hello. Always grateful to everyone sharing. Lubbock, Texas, really all over the country and the globe. Hey, Natalie, our triage team and our Global Connect team is really doing an awesome job. Really grateful to everyone and everyone's patience with the team members. We've been so busy and we're really grateful to all of that. I'm going to jump right into some questions. Male fertility, female fertility, whether you're single, same sex, partnership, whatever it is, at CMI Fertility, we're here to help affordability. And we always like to focus on both high touch and high tech. And we do combine both of them in integrating Eastern and Western medicine in all of this. And there was a question, having a laparoscopic procedure, should I wait before doing IVF? Tony Lynn, how you doing? So looking for endometriosis or pelvic inflammation and scar tissue, I think is really important. Quite often you do the laparoscopy, you can go right into a cycle in the next month or two. Sometimes you'll find enough endometriosis that it might be worthwhile doing a month, 2 or 3 of some GnRH antagonist. Now the Orilissa is out, which is the oral suppressing of estrogen and reducing inflammation. So I think that can be real helpful. 150 milligrams once a day may be enough for 1 to 3 months. Typically, we're not here to treat it for pain or dyspareunia or dysmenorrhea. But if you have those symptoms, it may be more of an indication that you may have endometriosis, but silent endometriosis and infertility, repetitive implantation failure, or miscarriages are all common signs and symptoms of endometriosis. So I really recommend the laparoscopy, hysteroscopy early in the process. And you should be looking to do an excision, which we do at CMI Fertility, combination of excision and sometimes ablation of those very superficial areas in some areas, but mostly it's taking a bite out of the perineum to confirm the diagnosis, but also removing it at the same time, which may help improve your fertility, both naturally and with assisted reproduction, by the way. Let's see. I already said hi to Lubbock. Cynthia, how often does varicocele surgery actually work? Probably about 20 to 40% of the time you're going to get some improvement with the varicocele. I think, so the varicocele is the dilated veins in and around the testes. I believe it's an intra-abdominal pelvic inflammatory condition almost like hemorrhoids. And so changing to keto paleo is really helpful. And the surgery can help improve sperm function, quality, morphology, and motility. Sometimes you may not even be able to see it under a microscope with a standard semen analysis or DNA fragmentation testing. But you may look to having the varicocele repair from a surgeon who's done it. But there are some radiologic procedures where you can actually inject the veins, block off the veins in order to reduce the varicocele. So that's another option there also. Let's see. Hey, Mary McNeil, Terry. I had a great vacation, by the way. It was really relaxing. Got back this evening. Long flight from London, but really relaxing. And so grateful to everyone. Lindsay from Kentucky. Hey, Gia, how you doing? It is really, again, this week's going to be a rocking week. Dr. Corley's been holding things down. Dr. Ditkoff, Dr. Grossman, just everyone's doing really an awesome job. Cost of pre-genetic screening. So if you're doing PGD, which actually it's PG, pre-implantation genetic testing for aneuploidy. If you're doing PGD, it's usually for cystic fibrosis or other known genetic disorders, but you're going to add about $2,000 to $3,000 onto a cycle by doing that. And we do offer that for everyone. I don't recommend it for everyone. There's some reasons to do it and not to do it. It's not perfect. It's not always 100% accurate either. I'm looking forward to seeing everyone. Hi, Tiffany. How you doing? And Natalie. And I hope everyone's having a really great, relaxing Sunday. And making sure that every day a little yoga, Tai Chi, and meditation. I was listening to my friend Susie Birchnoff talking about carbon dioxide poisoning, which we breathe in oxygen and we breathe out carbon dioxide. And this is why yoga is so helpful in the breathing. Clear out the carbon dioxide, reduces inflammation, helps the blood flow locally, helps the blood flow in the ovaries and the testes and the uterus, which helps those organs function better. And hi, Kelsey from Utah, and Penny, how you doing? Let's see. And I will be there, busy day this week. Endometrial receptivity assay, ERA testing, by the way. We are promoting it. We're still trying to get it legal in New York. It's kind of crazy, but we have someone in Toronto and Atlanta and all around. We'll utilize your OBGYN if they're willing to do it. We're more than glad to help. Send the order to the docs that they can actually directly order with the lab itself. Kayla, how you doing? And Kelly, Beth Ann, Jess, always a pleasure. Myalicia, Smiley, hello. Jessica, can you speak to one, does IVF increase risk of SIDS, and two, essential oils and how to use them? Let's see. So the essential oils, absolutely. CBD oil, another essential. And Vicki Mullins in the Young Living, really recommending. And remember, the oils are an herbal medication which helps reduce inflammation, helps blood flow. Highly recommended. And in general, the actual fertility treatments in and of themselves don't increase SIDS, sudden infant death syndrome. But my bet is, because so many infertility patients have a high amount of inflammation, there may be a slight increased risk of all infertile women having that slight increased risk of SID. So whatever we want to do, we want to focus on reducing inflammation in our bodies. That's why keto paleo, spread your meals out, 1 to 2 meals a day. There are vegan and vegetarian keto recipes out there. You want to add the fat. So real keto and paleo is a high fat diet because much of what we do is add fat through interlipids to reduce inflammation. And my bet is, for so many SIDS, it's likely the same thing. Moms are eating a high carb diet. Babies are eating a high carb diet. This high carbohydrate plant-based diet is simply adding a ton of plant antigens and inflammation that's pre-diabetes, essentially, metabolic syndrome. Read more about it, but I've been talking so much about it, and Marie Emmerich's stuff on keto is really helpful, and so I want to give a plug for Maria. She's awesome. And Gary Taub's Good Calorie, Bad Calories. If you haven't read it, this is amazing. I do a lot of audiobooks because the more you put this stuff in the brain, the more you're going to understand it. Because when you first read about this stuff, it doesn't make any sense. So IVF doesn't increase SIDS, but in general, I think the infertility diagnosis is all inflammation. So you got to be careful about that. And from babies in the womb, all of us should be taking care of our bodies like we're Ferraris. And if you haven't checked out my TEDx talk on the human Ferrari, just Google Dr. Rob Kiltz and TEDx and listen to that and share it with your friends, your family at all ages, because reducing inflammation is the key. Remember, we are the most valuable, expensive, irreplaceable being of the universe. We need to take care of our bodies better than we have been. Get rid of alcohol, drugs, tobacco. And when you do keto, you get rid of all those needs for all those drugs. And at the museum in London, there was a great show on all the pills that we use throughout our lifetime. And it's outrageous and it's crazy. So what we're working to do is help on the natural side. And if it's not happening natural, then obviously the technology that we've all developed through the years is helping so many find the success. Let's see. Christy, all blood work was great, did everything I was supposed to. And this is the second time I ovulated from last appointment, from trigger to retrieval. It is very devastating, absolutely. Double the Cetrotide. Is there anything else? You know, it may be doing a long Lupron. So rather than the Cetrotide, use Lupron to suppress. So do the birth control pill followed by the Lupron and do daily monitoring rather than every other day as we commonly do, and trigger early at 16 to 17 millimeters for sure. And sometimes we'll do double Cetrotide morning and night as another method of doing that. So we're here to help and help make sure that doesn't happen again for sure. But you know, the human body, it's supposed to go one way, but it often goes another. And why do we have infertility and diabetes and hypertension and all these diseases? That is the frustration to the process. Let's see, Danette, what is Pixie? And is it better than ICSI, and what is the cost? So Pixie is actually, there's a little disc on a dish, and you drop the sperm around it, and the motile sperm that is thought to be more likely to attach and create a fertilized egg would attach to the disc. So we take the sperm off the disc and then inject it into the egg. That's with ICSI. So you have to actually do the ICSI. I think it's a couple $100 to add it on. I'm 50-50 on how much it really helps, but if everything you're doing isn't working, then it's something then we should look at and talk about. Erica Nelson Williams, hi, and Chelsea from Texas. Kelly, thank you. And you know, it's not a perfect process, and you know, we're healthcare providers that have been taught one way, and quite often it doesn't work the way we thought it should. And so we always have to sort of turn around, look around, try something different. And it can be very frustrating when what you thought was supposed to work doesn't work. It's disappointing. You don't get eggs, you don't get embryos, you don't get a transfer. You do a transfer and you don't get a pregnancy. And so we'll always want to look and say, okay, what did we do that could have been better? What do we all learn from that? And in some way, IVF is a diagnostic test. Do we get good eggs? Do we get good sperm? Do the egg and sperm, are they compatible? Does it fertilize? Do they divide and make at least day 3 cleavage embryos? Do they make blastocysts at day 5, 6, and 7 stage? And some people will make great fertilized eggs, but they won't make cleaved eggs or embryos. Or they'll make cleaved but won't make blast. And so we learn something that we might want to change things up. It might be the stimulation protocol. It might be laparoscopy, hysteroscopy. It might be adding human growth hormone to help the egg quality. It might even add human growth hormone for the guys to help the sperm quality. We do a lot of HCG for the guys. We do a lot of DHEA, CoQ10, fish oil. All these things will help improve the egg and the sperm. And then the low-dose naltrexone and the CBD oil, we're really working on that quite a bit for both men and women. And the ovasitol or inositol, which is to help reduce insulin and glucose levels. And I believe that glucose is the leading cause of all of our damage. We're basically eating like we're grazing animals on all fours, but we're not. We're more like carnivores, although you can eat mostly a plant-based diet, but you have to simplify it, add butter and cream or coconut oil, and separate them out tremendously in order to reduce the inflammation in our guts. It all stems from what's going on in the belly, by the way. Let's see. I'll do a lap. Sarah Rado doing a lap for endo, excruciating pain every month. So the pain with either intercourse or your menstrual cycle or just pain at any time may be an indication of endometriosis. But in my belief is that that endometriosis is the silent cause of infertility, which is just another inflammatory condition in the big basket of inflammation that basically causes every disease we have. And the term autoimmune diseases, I think it's the wrong term. Our body is actually reacting against something in our body that's foreign. Plant antigens, virus, bacteria, other microorganisms, or other things that get in, glidins, lectins, tremendous damage to the cell walls, the mitochondria. And remember, we're eating a tremendous amount of sugar, which is causing glycation, which damages the mitochondria, damages every cell of our body, causes a systemic vasculitis, and causes the microvascular damage in the testes and the ovaries and the uterus and the endometrium. And then I believe that endometriosis is actually just peritoneal inflammation that is de novo coming from the gut. That's the interesting part. Hey, Kim Haler, how you doing? Miracle Twins 9. Wow, what a great thing. We're so grateful to so many out there. Let's see, embryo adoption. We do embryo adoption. Osa Wenry. I apologize if I pronounce any names incorrectly. Davis is her last name. We do embryo adoption. Embryo donation is a better one. We also help make embryos, donor sperm, donor egg, donor embryo. And there's just so many ways to do this. Let's see, Danette and Joe, how you doing? Let's see, ovarian endometrioma. Let's see, Terry Kernan Fullen. Ovarian endometrioma affects egg quality, but can you explain how? All right. So, chronic inflammation, eczema, psoriasis, arthritis. So the endometrioma is just a large abscess of inflammation, basically, that is affecting locally and damaging the follicles or the small cysts or cell clusters in the ovaries where the egg is. And so the basic endometriomas are just a big abscess, although it's not caused by a bacteria or yeast. or other viruses, microorganisms, but and you got to be careful when you remove the endometriomas. You could be removing a lot of the eggs. So in general, you want to be careful excising those, and the less you do to the ovary, the better. You got to be careful about large excision of ovarian tissue or ablation. Let's see, and genetically getting to blast. Again, inflammation affects so many things in the development of the egg, the sperm, the interactions, the development of the embryo, to both the cleavage and the blastocyst stage. So, and I believe that there may be some genetic predispositions, but the sound causes of even the genetic abnormalities is the inflammation that causes a microscopic inflammatory condition in the cytoplasm, in the nucleus, and causes DNA destabilization. By reducing endometriosis, either excising it, keto, LDN, CBD, will help tremendously in all this. And then again, the Orilissa or the Lupron, we really shy away from the Lupron. I think the Orilissa is going to be really an interesting one. Sandy Young, how you doing? We're looking forward to the conversation. Emily, Chelsea, let's see. I think you're looking at about 2,000 to 3,000 for the laparoscopy for endometriosis. We do have very good rates for that, and we do full payment plans for all of that. Allison, how are you doing? My donor aid team is amazing. Stephanie, Allison, Liz, and Kim. Grateful. They're really, really busy and working with people around the globe in helping them fulfill their dreams. Stephanie, how you doing? What can I do for a thin lining and hasn't gone above 5.5 during a monitored cycle? Will the lining thicken, make or break an IVF cycle? Phone consult coming up. So a thin lining is a factor. Again, inflammation, a biopsy and a culture could be helpful. A 30-day dose of Doxy or Zithromax or Keflex could be helpful. Laparoscopy for endometriosis. We've been looking at PRP, platelet-rich plasma, intrauterine, but using gonadotropin stimulation can help that also. So sometimes people are natural cycles, they're thinner, or Clomid or letrozole thinner, but by adding a little bit of estrogen and also using the gonadotropins going left, Menopur or Follistim, and then also intrauterine Neupogen or subcu Neupogen or intrauterine HCG can also be helpful for that. And we'll be glad to talk more about that. But the whole intention in this conversation of Fertile Fireside Chats is that we're able to help people conceive naturally without ever coming to us, gain information that they may be able to take to their OBGYN, their fertility doctor, and help them on this crazy journey of infertility. And Mike and Minnie Jones, hello. So I hope I answered your question, Stephanie. And I've seen plenty of pregnancies and deliveries with a 5.5 millimeter lining. So don't use it as like, oh my God, this isn't going to happen. Let's see. Vanessa replying to Rachel, age range. I missed that one. I'm sure these questions are out there. If I had an ERA with a different protocol, such as progesterone injections every day, along with endometrium, does that change anything? Theoretically, with the ERA, so the endometrial biopsy is used with whatever protocol you're going to do for your frozen embryo transfer. We typically recommend that. Now, theoretically, it could be used just as a diagnostic. On this day, am I receptive? But in general, we're trying to time it for a frozen embryo transfer. So if you're doing a blastocyst, you're biopsying on day 6, and that biopsy basically will tell you whether you're going to transfer on that day, a day earlier, a day later. And if you're going to do a cleavage stage embryo, then it's typically on the 4th day, and you're going to adjust it based on when that day 6 biopsy was done. And always remember keto, keto, keto. Ensure mature eggs. My first cycle here, M1, 11 tree, but only 5 mature. All right. So the tough part is you're not going to get, in general, you're not going to get all the eggs mature, but add a little bit more Menopur, trigger with a combination of HCG and Lupron, and the human growth hormone is another one to add to that. And it may be using the gonal-F or follistim to Menopur as a 1-to-1 dosing, and in some cases we recommend the whole kit and caboodle with Menopur, but there's a lot of controversy in that. It's not always straightforward. Erica, thanks for the shout out. London was really great. We do see lots of patients coming from London and Europe, and China and the Philippines. Tara, how should a lap be done? 3 years ago, 2nd stage. You know, if you've done a laparoscopy and it helped get a baby, then I think doing it again can be helpful. If you did it and you didn't get the benefit, you know, maybe every couple of years, but there's not a real straightforward answer on that one. That's another one. Hey, we've done all these things and we did it a few years ago. Maybe we didn't do the excision. Maybe look again. Add the Orlissa, keto, LDN, CBD. Those are the things to look. How is mini IVF different? Marley Jones. So in general, the mini IVF is just either lower medications or no medications, but you still need to do the trigger shot. So typically we're going to use the gonadotropins, gonal-F, Menopur, follistim, or with some low-dose HCG. You're going to take those shots for about 8 to 12 days, on average 10. Usual dosing is about 225 to 300 units of those gonadotropins. So a mini dose is going to be 150 of the gonadotropins or less, with a little bit of Clomid or a Femara letrozole. So it's a lower medications, and typically you're going to not get as many eggs. And in that case, typically if you're younger, or if you have diminished ovarian reserve where a high dose of meds is still only going to get 3 eggs, that may be worthwhile. So typically we're going to do 100 of Clomid or 5 of letrozole plus 150 of gonadotropins, either gonal-F, Menopur, or follistim, or some mixture of those. And you know, we're all fancy chefs. There's lots of different ways to do this. There's not one way. If what you did didn't work, you got great eggs and embryos, but you just didn't get pregnant, well, it may be just keep on doing it. But if you didn't get as great of eggs or great of embryos, you didn't get as many mature, then shifting it up and changing it up, I think, is real important in all of this. If you're watching, sharing, and just checking us out, we do a monthly free IVF giveaway. We have, again, affordable pricing. Everyone can get financing, and we do it up to 3 years. We're here really to help make it more accessible and affordable. We've been so busy. The morning show is coming out. Today's show is coming out in November, going to be highlighting our story. The Wall Street Journal highlighted it. But again, it's just a story of another way, another option, integrating Eastern and Western medicine, looking at more natural approaches. And again, not everyone needs IVF. It's just another part of the options. So we do a lot of IUI, timed intercourse cycles, a lot of immune protocols. So if you're failing to conceive naturally or repetitive losses, adding the immune protocol, low-dose steroids, the low-dose naltrexone, CBD oil, keto, intralipids weekly, Lovenox, with baby aspirin, and then looking at Neupogen, Humira, Plaquenil, Prograf, and IVIG. So there's a sort of the immune protocol light, medium, and the high test fuel. Again, there's lots of different ways to do this, but remember, the problem is mostly immunologic inflammation that caused the infertility and caused the damage in the first place. Reducing glucose, carbs, and fruits and vegetables are carbohydrates. It's a hard one. The kale is a carbohydrate. And I did have a few more carbs on my vacation, by the way. So I'm not completely against eating carbs and from time to time, but remember, you want to really take care of your body because it's your body and you got to get rid of all the junk on a regular basis. And remember, alcohol, tobacco, marijuana, deadly, deadly. When I talk CBD, cannabinoid oil, which is no THC, less than 0.3% for sure. And talk to your practitioner. Just Google it and read about it. I believe it's one of the most, it's basically an essential oil. And hemp has been around for thousands and thousands of years, used to make food, clothing, herbal medicines, you name it. Hemp plant has been used. And my conversation regarding keto is again for everyone in your life, not just the infertile ones. So pass it around. My sister Marianne, who passed from diabetes, heart disease in her very early 50s, and had it since she was a young child. Really, I'm seeing so many more people suffering diabetes, hypertension, stroke, cancer, you name it. It's not obesity as the cause, it's the diet is the cause. And the diet that we're told is healthy is not. And I know I sound like a crazy man, but basically get off the treadmill, Tai Chi, walking, meditation, prayer, listen to something really upbeat and positive, and keto. And again, Maria Emmerich is the home run. And Maria's coming next year. We're going to do a seminar. We're going to do a health fair with Nature Time, and we're really excited about that. And Ananda and Imani, how you doing? And Bonnie, all great. Really grateful to everyone for their shout outs. Let's see, Danielle Torres, do you commonly have people transfer embryos to you? Is it safe? And from Indiana, yes, the transport of embryos is safe. People transfer them all the time, and we're glad to help. We do again offer frozen embryo transfers at a lower cost. We do incorporate immune protocol, and remember, it always starts with faith and food. Keep that in mind. What are your thoughts on low betas? Is it still possible okay if they're rising? Well, we like to see the HCG levels going up about 1.5 to 2 times in a 48-hour span. Now, it's not always the case, and so you just can't give up, but we like to see it on that trajectory, and it's going to do that past about 6 to 8 weeks, and then you're not going to see it do that same doubling. It's going to flatten out. But that, along with a progesterone level, we like to see a progesterone level greater than 10 with that HCG level rising. Sometimes you got to be careful if you're on the HCG supplement booster, and we do occasionally use the booster. I like to wait until you get a positive test because the HCG booster, 250 units a day, may help reduce miscarriage also. But if you're doing it in order to enhance implantation, you're going to get that false positive, so you got to just be aware of it. And remember, emotional process. This is hard. And, the things that are supposed to be happening naturally and normally, and when they're not, it drives us bonkers. We get angry, sad, depressed, and we need sometimes to back away. find a fertility coach. Erin McCullough's been doing Fertile Hope Yoga. She's got some really great cards now, some mantras. We need to be listening. And on our CMI Fertility website, we have a lot of meditations available. Whatever you can do to calm the mind. If you haven't read The Secret by Rhonda Byrne, and check out my book, The Fertile Secret, which basically I tagged on a little bit to the power of positive thinking, which is basically faith. And remember, our faith is challenged every day. And don't lose it, though. Tap back into it. When you want to run away, just stop and take a breath, hug a friend, talk about it. And remember, journaling really is helpful. Think it, ink it. That helps the mind every single day in healing. Hello, Lizzie Rafferty. How you doing? Rachel, speak about HCG use in male fertility and high FSH, low testosterone. All right, remember, keto, 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 get rid of the inflammation. LDN and CBD, get rid of the inflammation. HCG may help improve the direct production of sperm, and it'll help boost the testosterone levels. Even in guys who have high FSHs. So some people think that high FSH automatically means it's done, but not always. And so if you're getting sperm, put it on ice. If you're having that high FSH, just like women who may be premenopausal, the FSH starts creeping up, AMH goes down, you want to put those eggs and sperm or embryos on ice to preserve your fertility for the future. The HCG supplement, I use 250 units a day. It's the 10,000 unit vial with 10 cc's of water, quarter cc injected sub-Q every day, can be real helpful. And for the guys who are on testosterone, as long as you're taking the HCG, you're okay. But if you're on the testosterone, not taking HCG, if you're using Clomid or Letrozole, that's not enough. You may actually suppress the sperm production. So talk to your urologist. We do a lot of it directly. Dr. Trussell works with us directly, but we also will help on the male fertility side. But remember, keto, 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 get off the treadmill, slow it down, cool the body down. Remember, when you're running, you're heating up the core, you're increasing friction, heat, damage, inflammation. It's really, really crazy. Let's see, Hillary Allison, yes. I got back at 5 o'clock tonight. I wasn't quite sure. It was an all-day flight. I watched some great stuff, Robin Williams, something about waste in food and how much food we throw away. And we need to be more cautious of that. Inflammation. Let's see, consultation December 26th in Buffalo. Shauna, how you doing? And let's see, Kayla, high platelets, Nevin. So high platelets is just another inflammatory indicator. And looking at hemoglobin A1C, ESR, SED rates, all of these are evidence of inflammation. Uterine fibroids. Okay, so tumors of the uterus called uterine fibroids are sinks of inflammation, kind of like endometriosis. I personally think they should be removed. Tiny ones in general, if you're doing a lot of other things to reduce inflammation, not necessarily so, but if they're in and around the cavity or they're larger than 2 centimeters, I think they'll change the blood flow, increase inflammation. You should probably talk to your gynecologist that does removal. Either laparoscopic or combined laparoscopic and mini laparotomy can be helpful and improve fertility by removing them. Again, inflammation due to a high carb diet causes uterine fibroids, the same as endometriosis, same as infertility, hypertension, diabetes, all the same. Sydney, I look forward to talking to you tomorrow. Let's see, Tima Dahl, how you doing? Sherry, and whoever wins can give it away, by the way, on that IVF cycle. And we do a lot of work trying to find lower cost medications, Metro, Freedom, Integrity. We've used a tremendous number out there. Let's see, tubes removed due to severe scar tissue, chances of successful. So this is from Lisa Anzua. Yes, so by removing the damaged fallopian tubes, you remove the inflammation, you're going to enhance the implantation. It may be worth 2 to 4 weeks of an antibiotic along with that. And Charlotte, how you doing? Always grateful to Charlotte. She's done so much to keep me organized and keep our there's a business side to all this, and we have so much going on in the back end. Our financial team, our medical billing team, and just to keep the whole process moving is a tremendous amount of work. And I just wanted to thank everyone from the front office, clerical, cleaning, maintenance, inside and out, everyone, and really so grateful to everyone. Monica, how you doing? Erica would freeze my fertilized eggs at day 3 versus. All right, so in general, depending on the quality of the embryos, depending on the number of embryos, so the more you have, the better quality, the more likely we're going to go to blast. The fewer you have and the lower quality, we often tend to recommend a day 3 and put them away and transfer on day 3. I've seen so many people that don't make blasts, but they at least get a day 3, and by freezing them, you're gonna improve your odds with that transfer on day 3. Now, you can always thaw them and take them to blast, but in general, there's not one way to do this. I see so many people coming to us from other places because they only do day 5s or do blasts. Blasts can be either day 5, day 6, and occasionally day 7. And so we see so many that they don't get blast, they never get a transfer, but they make great day 3s. They come to us, they get a day 3 transfer, and many of them get a baby out of that. So again, we're looking for the answer, and you're going to read something, and it's going to sound like it's the right answer, but it's just another opinion. Fancy chefs, all of us. Dallas, Texas. Dana, how you doing? HCG again, yes, for male fertility. I really think it's helpful. And we really appreciate, and for whatever reasons, I've seen people where it didn't work with us and they were successful someplace else. And we're always here to help on the journey, one way or another, and grateful to everyone who's choosing CMY fertility. Okay, let's see. Laura Pipkin, how bad is FSH of 13.1742? Should I still try? Okay, do or do not. There be no try. Remember Master Yoda. 44-year-old, worse numbers than that. No eggs IVF, keto diet, pregnant on their own. So never, ever give up, because there's always a way to reduce that FSH, bring that AMH. And how do you start it? Remember, faith and belief. You got to talk to your ovaries and your testicles really nicely. Remember, massage, acupuncture, light therapy. I've been looking at the Beamer, which is electromagnetic impulse therapy, and that may be another something that we're talking about and coming our way. But LDN, CBD, DHEA, all of those, and human growth hormone, working to reduce the FSH, bring up that AMH. Remember, reduce the vasculitis in the body by getting rid of the glucose, getting rid of the carbs, high fat, and that's the key. Fat reduces inflammation in the body, helps the blood flow, helps the carbon dioxide get out the toxin, brings in more oxygen, and will help heal the follicle. And my belief is that egg is sitting there. It's not damaged yet, but the follicle cells that need to provide the support can't do it when it's trying to mature that egg. And so you may ovulate a bad egg, or you may not get an egg out of that at all. So absolutely, if you look at our website, you just Google our stuff and look at most of the stuff that I've been talking about, which is keto, keto, keto. Remember, faith and meditation and prayer are really powerful. And listen to something upbeat and positive every day. And don't forget those supplements. Low betas, I talked about that. Let me shift down to the bottom a second. And really grateful all those that are hanging in. Some come, some go. Again, share it throughout the week. We're just going to keep on this journey. And remember, energy is going like this. And sometimes we're up and sometimes we're down. But you just got to keep moving forward. Let's see, Ashley Johnson, no fertility urologist near us doing pest and egg retrieval at the same time with CNY. And yes, Dr. Trussell does an awesome job. Let's see, worried the PESA may fail, only has enough time off from work to one time, only one undescended test remaining with azoospermia. We're going to work it out. We know one way or another, we're going to get it. And if we don't, we'll work it out. I know this is really hard. In one way or another, we have to have faith. I traveled all the way to London. I didn't have a hotel reservation. Went to the hotel, Rosewood, amazing spot, and got a room. It was perfect. Just have to have faith. And that's the power of positive thinking. And I know sometimes it's like hard to hold on to that power of positive thinking and faith. But in this business, I believe it really works. Check out my website, Mind, Body, Smile. It was my attempt at providing a positive, upbeat energy for my day and sharing it. And check out my intentions book, The Daily Intentions. Let's see. Do you have self-pay pricing for myomectomy? We do, Zara. And it depends on where it's at and how big it is, but we can work that out. Just task, if you're in our system already, you can send a correspondence. So remember to use the website and use the portal once you're a patient, and we'll get you connected in there. Let's see. Dawn Simpson Smith, no fertility issues, but my husband and I are genetic carriers for SMA. Tried donor FET, but did not take. Not sure what to do now since it was our only embryo. You can't give up and you got to keep going. That's the hard part to this process. But remember, always think about keto, laparoscopy for endo, because when it fails, it's going to be the same stuff that everyone else is dealing with. All right. Sharon Myers, should we be taking a good multivitamin during keto since we're cutting out vegetables and fruits? All right. Meat, if you're taking fatty meat, tip to tail, all the minerals and vitamins are there, believe it or not. Ovavite, Ovasitol through Theramegas, and the Conception XR are the prenatals for guys and gals. Theralogics. We can go right to our website on that. And Charmaine, how you doing? All right, so let's see. IUIs. 12, 24, and up to 36 hours after the trigger. That's the window. If you're going to do 2, it's 12 and 36 hours. If it's 1, it's anywhere between those. Sperm intrapelvic in general lasts for about 2 to 3 days. Let's see. Krista Stark, how you doing? Stim cycle, 3 estrogen, not increasing, but follicles slowly growing. Chris wants me to stick it out, and I'm scared to waste my last cycle. Thoughts? I'm not so concerned about the estrogen level. I care about the follicle size and the lining. This is a hard process where you have to sometimes bite the bullet and push through it. And we're here to help in the process if we think it didn't look right and we could have done better. And let's see, Danielle Vrzjevic, how soon after consult can one get started? Really, we can get you going right away. The intention of the consult is to map out a plan that day, by the way. Any advice, Beth? No known diagnosis for either my husband and I. We've been through a lot of testing, strict keto for both of us for months, using CBD, not exercising, meditating, slowing down our life, 2 failed IUIs. All right. So keep doing what you're doing. You could be a little more aggressive with an IUI depending on your age and how many follicles by adding a little bit of the gonadotropins with the Femara or the Clomid. I prefer the Femara, the letrozole. Same thing, by the way. And if you didn't do the laparoscopy, hysteroscopy, another important one. And then obviously IVF if that's not working. Light therapy, acupuncture, LDN, these are the things, and persistence. But that laparoscopy, hysteroscopy is one that I've really, really recommended so often. And Terry Schultz, thank you for your words. April Loris from Las Vegas. The travel from everywhere in the country is easier than people think. Whether you're staying at the Maplewood or another hotel or an Airbnb, or you're landing in JFK and traveling up to Albany 3 hours, or Buffalo and traveling to Syracuse, there's lots of ways to do it. Check your local airlines. You got to hunt it out a little bit. We see patients, again, from all over, and I know sometimes it takes longer to get in. I apologize, hoping we can do our best to give you really the best information possible in this whole process. Milena, how are you doing? Let's see here. Tied my tubes 11 years ago, and I went to a consultation. They said I only need transportation. I was wondering, I need the all process. So the most of the hotels will take you from the airport to the hotel and to our office, by the way. And we do recommend traveling with a companion, but we do have a tremendous, excellent nursing staff that'll work to take care of you while you're here and help reduce any risks in the process. Remember, this is not without some risk in the process. And so we want to help minimize that, make it as smooth as possible. Share with us ways we can do better for you, by the way. We always want to know. Let's see, Amber, 5 eggs fertilized day 1. Is it possible to freeze 1 to 2 on day 3, that they're not all lost if they stop growing after day 3? You can certainly freeze some on day 3, take some to blast. I do a lot of day 3 transfers. They work very well. And typically if you have 4 or fewer embryos on day 3, I recommend freeze. 5 or more, go to blast. But again, individualized, we have the conversation. And sometimes we're using our experience and our knowledge, but we want to make sure it's working with what you want in the process. Let's see here. Kayla, how you doing? Wallen. Thank you to all the great shout outs, by the way. Really appreciate it. I'm learning every day in this process. And when I was in London, I was learning. I was checking out some centers out there, kind of listening and learning what they're doing. The ASRM meeting was this last week in Denver. Dr. Ditkoff, let's see, Donna, Lee, Olivia went, and O'Kelly went, and they brought back some really great stuff. Dr. Ditkoff, I mentioned. Much of it we're already doing human growth hormone. We're already doing a lot of freeze-all cycles. And so we're always out there learning new stuff. PRP, we've been doing a lot on inflammation, and I think most everyone is behind on the food. And when I say food, it's fertile fatty foods. That's what makes babies. You gotta add the fat, butter, cream, eggs. I call it the baby diet: bacon, eggs, butter, beef, bam, baby. And for those vegans and vegetarians, coconut oil, cream, butter, eggs, and you know who you are, and separate them out and simplify them. And less variety. The variety and spice is not good for us. That variety is deadly. I think that's one of our big issues. Share the support. This is a village of support. And really grateful to Sarah and her support, and all those others out there supporting keto, supporting acupuncture, supporting massage, supporting Eastern and Western. But we're really talking to all sorts of herbalists and naturalists, and really gaining knowledge from ways that maybe we didn't learn as physicians in a standard way. Let's see here. Jess Graham, fibroid in the outside of the uterus, about 4 centimeters, says it's fine. I think those larger fibroids are factors. It's true, some people have success, but if nothing else is there, I've seen so many times when we removed it and then bingo, pregnancy happens. Thanks for sticking with us for the hour, by the way. We're going to finish up in just a few minutes. Again, just as long as you showed up, you're put in the pile. Nephew Will, down in Manhattan now, really working to share. We're going to continue this, but again, continue your support, your thoughts and ideas, and helping all of us on this journey. Again, hard. And check out my book, The Fertile Secret, and we're working on the keto secret. Kiltz's keto, I call it, which is way over here, bacon, eggs, butter, beef, and Emmerich keto. It's a little more variety. She's got amazing cookbooks. She's join her private group, and you get a little bit of extra secrets in the process. Let's see, Moody Banks, several cycles of Clomid with no success. Would you recommend injections or straight to IVF? All right. So if Clomid IUI is 10% per month and injectable IUI is 20% per month, then IVF is about 40% per month. Now, there's some variation to all of that, depends on your individual factors, but it just kind of gives you that Clomid IUI, injectable IUI, and IVF, deciding whether or not you want to jump here or you want to jump right up to that next level. And let's see, Nicole Ford put out a great link and really great resources. Thank you for sharing, everyone. 2 more minutes. Let's see. Trini, fall stem retrieved 18 up with 6 days. 6 day 5 and day 6 now. My insurance doesn't cover. Let's see. Now it's going left. I still have fall stem. Just trying to figure out which do I do next time. So I think you could use and interchange them. But some people, they did better on follistim and you did great, stick with it. But maybe go the first few days with follistim and then mix. But mixing, I believe, is okay in the process. Okay. Tracy, high FSH at 12.9, 44, obese. I think we got to stop labeling our sizes, right? Got to figure something out. Maybe just a BMI so we have an indication of of sort of the metabolic state, and we should leave it at that. And absolutely, there is a chance. Donor eggs are going to give you the higher chance in that cycle, but by doing keto, and remember, we get depressed, oh my God, it's going to take long to do this. Every single journey starts with that first step, and you have to believe first. That's why I recommend the listening, the stories, the more positive. All right. Gratitude to everyone for hanging in there for the hour. Thank you. We'll see you next Sunday or in that conversation, or if we're going to do a live chat. Dr. Rob Kiltz, God bless, and enjoy this beautiful, beautiful week.